right, welcome back. This is Body Garage on TV 47, and on this episode we are focusing all matters kidney. And as you know, just in March, Daktari, we would be celebrating the World Kidney Day. How important is this day, and why is it observed annually?
So the World Kidney Day basically is an event that is observed on every second Thursday of March annually. And it is been designed to create awareness about kidney health. And so this year again is going to be on the 13th of March, which is on a Thursday. And the theme for this year's World Kidney Day is, are your kidneys okay? Early detection to protect your kidneys. That's the theme of the World Kidney Day. And why this theme? So, as we mentioned earlier, sometimes it is difficult for people to know that they have kidney disease until it's too late, because the symptoms that people with kidney disease present with when it is early are very vague. So people just generally are tired. Sometimes they are not. They get fatigued very easily, and those are among the early signs. And of course, in this day and age where everybody is hustling, working 24/7, you'll be like, yeah, it's because I work too hard. Nobody takes it seriously. And by the time that you're getting now the symptoms of, the actual symptoms of kidney disease, whereby your legs are getting swollen, your urine output has reduced, you're vomiting, you're having itchiness all over the body, which are among some of the signs, it's a bit late. By the time a lot of damage has been done to the kidneys. So that is why we ask the question, are your kidneys okay? And how do you know if they're okay? By doing tests. And the simple tests are basically a urine test and a blood test. So of course, we are not saying that everybody should get a blood test and a urine test. If it's ideal and if you can do it, then please do it. But there are people who are at risk of getting kidney disease. And these are the people who need to be more watchful and get this test done regularly. As we mentioned, diabetes, hypertension. Now, if you look at diabetes and hypertension, those two are the most common causes of kidney disease worldwide, including in sub-Saharan Africa and in Kenya as well. So if you look at all of our dialysis units, majority of our patients in our dialysis units have diabetes and high blood pressure. So if you have those, then you are at a very high risk and you have to go for regular kidney checks.
How would you rate the awareness levels, especially here in Kenya, and what are some of the activities that are done to ensure that there's awareness even to the grassroots levels?
So this is why the World Kidney Day is celebrated, and it is encouraged that every country is supposed to celebrate the World Kidney Day. So here in Kenya, unfortunately, the awareness of kidney disease is not so good. And this is where we do require the help of the media to make sure that the message reaches the grassroots levels. Okay. We have an umbrella body called the Kenya Renal Association. So what we do is that the Kenya Renal Association then organizes the activities for Kenya. So all the counties are actually participating. I'm the Secretary General of the Kenya Renal Association. And although the World Kidney Day is celebrated on one day, but we do try to have the whole week activities to create awareness about about our kidneys. So even here at the MP Shah Hospital, what we are going to do is that we'll be doing free screening every day from 10th to the 14th, which is Monday to Friday, at the MP Shah Hospital, whereby we'll be having talks, we'll be checking your blood pressures for free, your blood sugars, and your body mass index as well to assess for your weight. And of course, those people who are identified to have any issues, then they're basically referred to the nephrologist. The Kenya Renal Association will be holding the celebrations this year at the Kenyatta National Hospital, where again free screening will be taking place. There'll be talks given by professionals. There will be skits, and we are hoping to also involve the Ministry of Health, so that with the help of the Ministry of Health, we can pass on the message to the public about screening for kidney disease and getting your kidneys checked.
Could you touch a bit on the statistics? how they look like in terms of, those affected by kidney infections, kidney diseases here in the country?
So if you start worldwide, almost 850 million people have chronic kidney disease. So if you look in Kenya, we have a prevalence of 10% of our population having chronic kidney disease. So if you take a population of 51 million, 5.1 million have chronic kidney disease, out of which almost 500,000 require some form of treatment. And almost 20 to 30,000, of course, that is much less because we don't have the actual figures. We're actually in the process of collecting that data, require dialysis, which is a form of therapy for patients with end-stage kidney disease. Now, if you look at the number of patients who are on dialysis, we have currently around 7,500 to 8,000 patients on dialysis. Of course, it is still not yet reached even half of those patients who do require the dialysis.
This day is all about, raising awareness. And how would you, tell my viewer the importance of accessing timely testing for kidney diseases?
So if we do catch kidney disease at an earlier stage, there is a high probability of us being able to reverse the kidney disease. Of course, if it is at a later stage, then it is still important for it to be diagnosed so that we can reduce the progression of that kidney disease to end-stage kidney disease, whereby now the patient has to be put on either dialysis or has to be transplanted. So that is very important. And for the past 3-4 years, we do have newer drugs in the market which are actually helping to slow down the progression of chronic kidney disease to end-stage kidney disease. So there is hope. But the most important thing is identifying that you have kidney disease. That's a first step. Yeah.
Okay. And would you say that some of this awareness, activities that have been conducted have actually led to, low death rates, especially in connection with kidney diseases?
Now, unfortunately, the World Kidney Day is celebrated once a year.
Yes.
So that is also a major problem that we have. As I mentioned, that we as healthcare professionals, as hospitals, as healthcare providers, we need to partner with the media, because the media is a very powerful tool, and this needs to be done on a regular basis. So you need to have a series of programs for kidney disease, not just one-off. And so that it can basically create awareness about kidney disease and what are the symptoms of kidney disease, what are the signs of kidney disease, and how do I protect my kidneys? Am I at risk for developing kidney disease? I've started a YouTube channel whereby I have done some videos on all of these basic things for the public. And it's for free for everybody to access and to share with everybody as well. Because I feel that it's very important that everybody should have that knowledge, that to know that, I need to check my kidneys. I need to know what the symptoms of kidney disease are. Am I at risk of developing kidney disease? What do I do if I have kidney disease? Yes.
And what have been the outcomes of previous, celebrations since it's celebrated annually? Say, for instance, last year, in accordance with its theme, are there some outcomes that you see, we can celebrate some major milestones?
So it's difficult to assess and see, because what happens is people just come once and then they disappear, because a lot of people on that particular day gather at the main hospital, which is our Kenyatta National Hospital, and then after that there's no follow-up done, which is why even this year what we've decided to do at the MP Shah Hospital is that we'll also be conducting our own screening as well, and then we'll be taking down the patient's contacts and then following up the patients to make sure that at least if there's anything abnormal that we do pick up, the patients are then followed up. So it is not that it has been in futility, but every time that we do have this, it does create more and more awareness. Now we have patient groups and which are now lobbying to create more awareness about kidney disease. So there has definitely been an impact. And I'm proud to say that in Kenya, I think we are among the nations in Africa that take kidney disease very seriously. We have a very robust association called the Kenya Renal Association. There's a Nephrology Nursing Association as well, which now it's the nurses who are also who are part of it and take charge and also create awareness, and they do free medical camps as well, at least once or twice a year in collaboration with the Kenya Renal Association. Here at the MP Shah Hospital, we have formed support groups for our patients as well, and there are also other support groups that are being formed. So yes, it is working, although it's a slow progress, but we are getting somewhere.
I'd love for us to begin the awareness right now, Dr. What are some of the earliest symptoms that someone should feel like or see to tells them that they're actually getting a kidney disease?
So if you notice that your legs are getting swollen, that's among the earliest signs. If you notice that your pee has changed color and has become very dark or black, or there's blood in the urine, or the urine output has reduced, those are the signs that now you need to be a bit worried.
When my urine output has reduced, it's a sign for worry. It's a cause for worry.
It's a cause of worry. So if you've been, let's say, going to the bathroom 3 or 4 times in a day, and suddenly you start going once, and of course it's not that you stop taking water or you're in a very hot environment and it's persistent. And then you need to ask yourself, okay, so what's happening? Let me get it checked out. Okay. Of course, if you are at risk and if you have the risk factors like what we talked about, the diabetes, the high blood pressure, if you're very obese, or if you have a family history of kidney disease, or if you have had kidney injury before and even if it recovered, then you need to be on the watch out. For anything small, you need to come to the hospital and have it checked out. Of course, patients with diabetes and high blood pressure need regular checks, at least annually, if your kidney functions have been normal. Every 3 to 6 months, if there's existing kidney disease already. Like if you already have been diagnosed to have kidney disease, then every 3 to 6 months, depending on the stage of your kidney disease, you need to have frequent checks.
And I'm curious, you've mentioned that if someone has a kidney injury, how does that come about?
So you can get acute kidney injury either because of an infection like malaria, or acute gastroenteritis like you present with diarrhea, vomiting, excessive blood loss like if you're involved in a road traffic accident, or you get a GI bleed, or if you take medications over the counter like what we talked about, especially the painkillers, which I feel should be banned, because that can cause acute kidney injury. A lot of times it does recover, but once when you have had acute kidney injury, your chances of developing another episode of acute kidney injury or progressing to chronic kidney disease is much higher than somebody who has not had acute kidney injury.
Okay. What are your pro tips to our viewer on how to keep the kidneys healthy and free from disease?
So again, the 8 golden rules apply. You have to eat healthy, what you talked about, the balanced diet. Exercise is extremely important. Okay, very, very important. Avoid over-the-counter medications. Hydrate yourself well. Very important. Okay, and make sure that your blood sugar is being treated well. Make sure that your blood pressures are being treated well. Okay, come for regular checkups. If you've been told that your kidneys have a problem, please come for regular checkups. Okay, yeah.
And you mentioned exercising, and I'm wondering in my head, how does exercising and the kidneys go hand in hand?
So when you exercise, you are basically increasing your blood circulation. So blood circulation to the kidneys improves, to the heart improves, your blood pressure improves, your blood sugar improves. And remember that those are the ones that most commonly cause kidney disease. The other thing is, of course, when you're exercising, you're also losing weight as well. So you have to lose weight. So exercise is part of the weight loss.
And as we wind up, Dr. Ari, on this World Kidney Day, perhaps a last message to my viewer?
So always ask yourself, are your kidneys okay? And if you feel that they're not for whatever reason, please see your doctor. Thank you.
Thank you very much, Dr. Ari. It has been a pleasure having you here on Body Garage. And thank you for you back at home for watching. Keep it TV 47 always. And of course, Body Garage. I have been your host, Sheila Chelagat. Until next time, it's goodbye and good night.